Today we are going to discuss blood administration and what that means for you as an employee of Preston Memorial Hospital. Here at PMH, we have packed red blood cells, fresh frozen plasma, and platelets. These various products can be used on patients for a variety of reasons, all with the goal of improving the patient's condition and ultimately improving the patient's outcome. When the provider suspects that the patient may need a transfusion, they will order a type and cross. The lab will get this order and come draw blood from the patient. This specimen is used to determine what type of blood the patient can receive, their Rh factor, and if there are any antibodies present in their blood that could cause a transfusion reaction. This is an important safety step to prevent a potentially life-threatening reaction from occurring. When the lab draws the type and cross, they will place a blood band ID on the patient. This unique number is linked to the patient and will be used to link the patient and any blood products given to the patient during their hospital stay. Bedside staff will use the stickers provided on the blood band ID to verify the patient is getting the assigned blood product during the two-person verification process conducted at the bedside. Bedside nurses must know that a blood consent is required before beginning any transfusions. During the consent process, the provider will explain to the patient the reasons that they would like to give the patient blood products. They will also explain the risks involved in receiving blood products and the risks the patient could experience should they decline blood products. The patient will have an opportunity to ask any questions about the transfusion process. As a bedside nurse, you will be responsible for witnessing the consent. You must verify informed consent before signing. Ask the patient if they know why they are getting the blood, if they have any questions, and if those questions have been answered by the provider. If the patient answers these questions correctly, you may sign the blood consent. If you suspect that informed consent has not been achieved, then do not sign the consent form and have the provider re-educate the patient on the need for transfusion, risks, and benefits. This is an example of the blood consent form. Make sure that all areas of the blood consent form are filled out appropriately. Ensure that the provider has signed, the patient or their surrogate has signed, and the nurse has signed as a witness. In the event that the patient is unable to sign for themselves and there is not an MPOA or healthcare surrogate at bedside, a two-person verbal consent may be obtained via telephone. Just make sure that you document appropriately for this. After the consent and type and screen have been completed, the lab will let you know that the blood product is ready to be picked up in the lab. Any staff member from the department may go to the lab to retrieve the blood product. The staff member will verify the specimen with a lab technologist. During this verification process, you will be cross-checking the patient information, unit number, unit type, unit expiration date and time, and the cross-match result. The lab technologist will sign you off that you've completed the checkoff and release the blood product to you. It is your responsibility to take the blood product back to your unit and give it to the bedside nurse for them to begin the transfusion. On the blood product, there will be a blood unit tag. This white tag will stay with the unit at all times. It contains vital information such as the patient that this has been assigned to, the unit number, unit type, and expiration date and time. On the back of this blood product tag is the procedure for if a transfusion reaction occurs. When the blood product has been delivered to the bedside nurse, a two-nurse verification process will be completed. An RN must be the first nurse verifier, but an LPN can act as a second witness. This process is completed at the bedside in front of the patient and their family, involving the patient if they are able to answer orientation questions appropriately. During the verification process, you will be verifying the patient's name and date of birth, verifying the blood band ID number, verifying the unit type, unit number, and unit expiration date and time. You will document on the blood transfusion data flow sheet that this verification process has been completed. This is an example of the blood transfusion data flow sheet. These should be kept at the desk of the unit secretary for your department. Nurses must be sure to completely fill out the blood transfusion data flow sheet. You may use stickers from the blood band ID and the unit in place of writing that information down on the top of the sheet. Make sure that you have 2 signatures for the verification process. Gather all equipment necessary for transfusion, including a filter IVY tubing set and saline. Tubing is only good for 4 hours to prevent hemolysis. You must also accurately document the start time for the infusion. Infusions must be complete within 4 hours of the initiation time. A baseline set of vitals is important to compare any later vitals with for signs and symptoms of a transfusion reaction. The primary nurse must stay with the patient for the first 15 minutes of the transfusion to monitor for signs and symptoms of a reaction. The vital signs should be documented at the correct time increments on the blood transfusion data flow sheet. After the transfusion has been completed, make sure that you document the time it ended. You will be responsible for taking vital signs on the patient 1 hour after the transfusion is done. You will give the patient post-transfusion education. It is the nurse's responsibility to make sure that the proper paperwork is placed in the patient's chart, including the blood consent and the blood transfusion data flow sheet. The blood unit will be returned to the lab in the plastic bag given by the lab technologist during the verification process. As the bedside nurse, it is best practice for you to ask your provider when they would like repeat labs to assess the patient's status and potential need for more products or additional interventions. As the bedside nurse, you should know that there are multiple transfusion reactions. The image covers hemolytic reactions. Many reactions have similar signs and symptoms, but can range from fevers and chills to shortness of breath, hypotension, itching, edema, and shock. If you suspect a reaction, your first step is to stop the transfusion immediately and begin a slow, normal saline infusion. You should call the physician and house supervisor. Orders should be placed for lab draws to include a purple and pink top tube. You will send back all infusion products that were hung, including tubings, to the lab for investigation. Blood bank nursing transfusion reaction electronic form should be completed in CPSI. It is best practice to check any other patients who are receiving blood products to ensure that they are getting their assigned product and there wasn't a mix-up. An RLS will be filed, but don't panic. This is to help us gauge where the system broke down and prevent any future occurrences. In the event of an emergency and there isn't time to get a type and cross, a physician can request emergency blood product release. This may occur when the need for immediate blood is greater than the risk of a blood transfusion reaction. Only a physician can sign this form and they maintain all responsibility in the event of a transfusion reaction. This form is given to lab and lab will release O-negative blood. Lab will get a type and cross and conduct antibody screening on the patient, but not until after they've already emergently released blood product. We try to avoid this, but emergencies happen and positive patient outcomes are our goal. Key points from this presentation. It's essential that we follow all protocols when issuing and starting transfusion to ensure that we are giving the correct patient the correct product. Patient safety is our #1 priority. Consents are necessary before any blood product transfusion, and informed consent must be achieved. Blood products must be transfused within 4 hours of the start of the infusion. Tubing is also only good for 4 hours. Remember, these are protein-based products. They can go bad, just like the potato salad you wouldn't be eating after sitting out for a few hours either. Fully document on the transfusion data flow sheet. Educate yourself on the signs and symptoms of a transfusion reaction and closely monitor your patients. Educate your patients on signs and symptoms of a transfusion reaction and encourage them to tell you if they are experiencing any of these symptoms. In the event of an emergency, blood can be released before a type and screen has been completed.